Dr. Ansert. How are you?
Good. My name's Krista.
Nice to meet you. So, can you tell me what's going on today while you're here?
So for the last couple of weeks, I've been getting really bad, heel pain on my right foot, and it's getting to the point where I can't get out of bed. Sometimes, it just hurts so much. So I figured I'd come in and get it checked out.
Okay.
I'm not really sure what it is, but.
Okay. When did that start?
Well, it's been getting progressively worse. I guess it's been almost like a month and a half now.
Okay. Did anything happen? Did you hit your foot on something, step on something, or was it just kind of like a gradual progression?
I haven't done anything to it or injured it in any sort of way. So.
Okay. Can you point to exactly where it hurts?
Yeah, it hurts right here.
Right here?
Ow, yeah.
That, okay.
Yeah.
Alright, I won't get worried. How long does it hurt for? Does it hurt for an extended period of time? Does it hurt 15 minutes? It hurts all day?
It kind of hurts all day. It's really bad in the mornings when I wake up. But as I go on throughout my day, it gets slightly better. And I guess it's fine.
Okay.
It's not crazy pain throughout the day.
Okay. On a scale of 1 to 10, how bad is it?
In the mornings, it's definitely an 8.
Okay.
8 or 9, yeah, it hurts a lot.
Okay, and then after that, you said that first step, how does it progress throughout the day at all, or it just stops after?
It does progress. I would say it probably goes down to a 4 or 5. Nothing crazy, but I can still feel it.
Okay. And is it a sharp pain or a dull pain?
Yeah, it's definitely a sharp pain.
Okay. All right. What about anything? Does anything help it at all?
Not really. I mean, I haven't done much to it. Sometimes, if I kind of get annoyed with the pain, I'll sit back up and put my feet up. But then I've noticed that afterwards, when I get up, it hurts a lot again. So I'm not really sure what to do. And then ibuprofen has helped to relieve, but.
Okay. So then, does anything make it worse, like high heels, or if you walk a long time, anything like that, make it worse?
I haven't been wearing high heels for a while now, but walking kind of almost seems to help a little bit. Just kind of, I don't know if it stretches it out or whatever, but.
Okay, so then does it radiate anywhere? Does it go up the back of the leg or to the tips of the toes, top of the foot, anything like that?
It doesn't radiate towards the back of my leg or anything like that. I can feel it almost throughout the sole of my foot, especially right here. But it doesn't go up anywhere really.
Okay, and then you said it hurts worse in the morning after you take that first step.
Yeah.
Okay. So now I'm going to ask some general questions just to get to know you a little bit better and kind of help me figure out exactly what's going on.
Okay.
So have you had any history of hospitalizations or surgeries, anything like that?
No, not that I can recall.
What about immunizations? Have you had any?
Yeah, everything is normal there.
You kept up with your childhood immunizations and haven't had any major ones as an adult?
Yeah, everything's normal.
Okay. What about any major illnesses as a child?
No, I just had the chicken pox when I was 5.
Okay. What about any major illnesses as an adult? No? Okay. What about, and are you on any medications?
No, just on birth control.
What about allergies?
I'm allergic to composine.
Okay. What about any blood transfusions or anything like that? Okay. Can you tell me who the president is?
Donald Trump.
Do you know what day of the week it is?
Yeah, today is a Thursday.
Okay. And then how are you feeling today? Are you kind of fine? Do you feel a little bit sad? Anything like that?
I feel fine, yeah.
Okay. What about any major family history? Any history of diabetes or heart conditions, lung conditions, anything major that you can think of?
No, knock on wood, everyone's healthy.
Okay. So now I'm going to ask you a kind of personal question,
Okay.
but it's only to help me figure out exactly what's going on. It's not for anything other than that.
No, yeah, go ahead, shoot.
What is your sexual life like? Are you monogamous?
I'm monogamous. I've had a steady boyfriend for about a year now.
Okay. What about how's your sleep?
I try to get as much sleep as I can. I probably around 6 hours. 8 would probably be a little bit of a reach, but 6 seems to do it. So
pretty comfortable. It says you
yeah.
kind of stay right around there. Okay. What about any smoking?
No.
Okay. What is your work? What do you do?
I work as a dentist.
Okay. Do you exercise regularly with that?
Yeah, I try to go to the gym like 5 out of the 7 days a week. So
okay, that's pretty good. What do you do when you exercise?
I jog on the treadmill or outside, and then squats, and then some arm exercises, and then I'll do either bike or elliptical.
Okay. Do you drink at all?
Just socially, if I go out with friends, and like a glass of wine here and there with dinner.
So like once a week, every 2
yeah.
weeks, something like that?
Mm-hmm.
Okay. What about any drugs? Any illicit drugs, over the counters, vitamins, vitamins and supplements, anything like that?
No.
Okay. What about your diet? Do you try and stay healthy or just grab what you can?
Yeah, I try to stay healthy. Meal prep throughout the week. So.
Okay. What about any pets? Do you own any pets?
No.
What about your marital status? You said you had a boyfriend. Are you divorced or you're just with your boyfriend?
Never been divorced, just with the boyfriend.
Okay. And then what about any travel history?
We haven't traveled anywhere recently.
Okay. So now what I'm going to do, I'm going to do a general exam for your lower extremity.
All right.
And if anything hurts or if anything's uncomfortable, you just let me know, okay?
Yeah. All right.
Okay. So I don't see any sort of lacerations or anything like that. I don't see any ulcerations. No mastication in between the toes. Your nails look great, these are very pretty, by the way.
Thanks. They're getting a little chipped.
Well, it happens. That's just an excuse to go get them made.
Yeah.
I don't see any sort of discoloration, any sort of dry skin, anything like that. No edema, anything like that. What about your temperature is normal, warm to warm, all the way down, which is great. Your dorsalis pedis is great, it's 2 out of 4. And then your posterior tibial is great also, 2 out of 4, but just to be sure, I'm going to check your popliteal, if you don't mind. And that's great, it's 2 out of 4 as well. I don't see any sort of temperature change, edema, color changes, anything like that. No signs of varicose veins or your skin turgor is normal, which is great. And you have sufficient hair growth, so that's great. Now I'm going to do a neurological exam. So what I'm going to need you to do is I'm going to have you close your eyes.
Okay.
And if you want to, you can feel this. I'm just going to touch the bottom of your foot with it. It doesn't hurt. It's not a needle.
Okay.
Anything like that. So what I want you to do is when I touch somewhere on your toe, just say yes if you can feel it.
Okay. On my toes?
On your foot in general.
Okay.
Okay.
Yes. Yes. I feel it. Yes. 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 Felt it. Felt it. Felt it. Yep. Yep. Felt it. Yep. Yep. Yes. Yep. Yep.
Okay, great. So now what I'm going to do is I'm going to test your reflexes. Can you hang your feet over the side for me? Okay. This way. Okay. Great. Thanks. And the same for this one. Okay. Great. Okay. So now I'm going to have you sit back again. And now I'm going to do a sharp dull test.
Okay.
And all I need you to do is I'm going to touch somewhere on your foot. You just tell me if it's sharp or if it's dull.
Alright.
Okay? Keep your eyes closed.
Sure.
Mm-hmm.
Sure.
Mm-hmm.
Dull.
Mm-hmm.
Dull. Dull. Sharp.
Okay, great. So now I'm going to do a vibration sensation test. And so I'm gonna make this vibrate, see, you can feel it, it doesn't hurt or anything like that. And then you just tell me when it stops.
Okay.
So tell me when you feel it and tell me when it stops.
Alright. I feel it. Stopped. I feel it. And it stopped.
Okay, great. Okay. Okay, so now what I'm gonna do is I'm gonna have you help me test your muscles.
Okay.
So go ahead and pull your feet towards you. Great. Did something hurt?
Yeah, the right bottom
Right here?
kinda.
Okay.
Yeah.
Now push on my hands like a gas pedal. Push, push, push. Good job. Okay, now pull my hands out. Great. And then push them in. Great. Okay, so now I'm gonna check and see how tight your Achilles is and see how that is.
Okay.
So I'm gonna have you lean back for me. Okay. Keep your legs straight. We're not getting quite to 90. Does that feel tight?
Yeah.
Okay. Alright, so now I'm gonna put your knee at 90. Find your subtalar joint neutral again. And then push. Not quite to 90 yet. Okay? And then I'm gonna do the other one, okay? You just tell me if anything hurts.
Alright.
Okay. STJ at neutral. Does that hurt?
Yeah, a little bit, but it's okay.
Okay. And bend your knee again. And here. Does that hurt?
Yeah.
Okay.
It doesn't feel comfortable.
Okay. Alright. Neil, the last thing I'm gonna do is I'm gonna check your cap refill, okay?
Okay.
So just tell me if anything hurts, but this is basically gonna be it. Okay. And they're all less than 3 seconds. Great. Okay, so I'm gonna look over and go talk to my attending real quick, and then we'll be right back, okay?
Great. Thank you so much.
Mhm.